Okay, so good afternoon, everyone. Today we will be talking about music intervention in ASD. So myself, Dr. Neha Gupta, and I will be talking about how music facilitates, and we will be mostly talking about safe and sound protocol today. So without any delay, let's start. See, music, as we all know, that it is one of the foundations where which connects the humankind. So music has various kinds of effect on all of us, and one of the primary effects is that it provides a calming effect, a soothing effect to everyone, and helps uh, us to enter into the parasympathetic zone. If you remember from my last presentation, we had talked about sympathetic and parasympathetic systems. So music is one mode by which entering into the parasympathetic zone becomes easier. So this plays a very key role in calming down. It not only calming down, if we see how music works, then the processes and the networks that are involved in the understanding of music, these are also the channels which can be used to enhance the cognitive, language, social, and sensory motor functions of children. If we see the long-term effects of the music, then the music-rich environment, the studies have shown that they produce a great deal of neuroplasticity and long-term changes in the neurotransmitters. So a lot of research has been done on how music affects the brain. There is a lot of data how it helps in the sensory integration, how it promotes sensory integration, how it helps increasing the intelligence and the executive function, how it helps in the enhancement of language. So music plays a role at various levels in enhancing the skills of the children. How music is processed in human brain. If you see this chart, there are variety of musics. It various forms it is available. It is processed in different parts of the brain. I won't be going into this detail. So effects of music. Now, how do we give the music therapy? It can be given in four ways: by listening, singing, music making as in using the instruments, or even composing, and rhythmic movements. So rhythmic movements will be your dance movements associated with the music plus your percussion musics. So both of these fall into this. So the areas that are affected by giving the music, these are communication, social, emotional, motor, sensory, perceptual, and behavioral. So you see that all the channels and all the areas of the personality development of a child or for the growth of the child, for socialization of the child, they are all addressed by music therapies. Now, various music therapies will target the different areas, like not one will address everything, but different music therapies are able to address different channels and bring about different changes. So what would be the easiest method? So these are this is a chart about various studies that have been conducted and as to how music affects in ASD. So what is the easiest method of, providing the music program or the different protocols? That would be through passive music. There are variety of music protocols available, but the most commonly used, I will be talking about those three and followed by safe and sound protocol. So the most commonly used three are sound-story, tomatis, and therapeutic listening and safe and sound protocol. So let's first talk about sound story. Sound story is the rhythmic music which is played on a patented headset that's worn during simple music movement exercises. So this particular music protocol, it is done with certain specific movements that are provided in the protocol. So according to this method, they claim that the ear and brain are retrained to process sensory information more quickly and accurately for better balance, coordination, and motor skills. So this particular system is working mostly on the vestibular and the auditory system. And they are using both the methods, like I said, movements and the music. So vestibular and auditory are the main target. Now, this program is a 40-day program where daily 30 minutes of music has to be given to the child with exercises. It is divided into 2 sessions of 20 days each. So this is how the program is implemented. Now, what are the primary problems that we have with this particular program is that, first of all, the headset. The headset that is provided by the company, by the protocol, that only has to be used. So you cannot use a normal headset. Plus, it is working mostly on your sensory integration, that too vestibular and auditory per se. In this particular protocol, before the reorganization happens, you might see a lot of disorganization. So you might see a lot of behaviors cropping up, a dysregulation coming in, sleep disturbances happening. So this can happen with this protocol. So before you see the positive changes, you actually get to see maybe the adverse effects, which is not adverse per se, but dysregulation before the nervous system can get organized. But that disorganization sometimes becomes very difficult to handle. Sensory is not adapted to help people with emotional difficulty. So that is another disadvantage of this system. Another program that is commonly used is Tomatis. Tomatis is a program which claims to improve listening and communication skills. With this program also, this is implemented by an electronic device called the electronic ear, which emphasizes the high frequency sounds. So in this method, again, there are special headphones which are used, which work both through bone conduction and the air conduction method. Now, this program, how it is implemented, it has an initial phase of 15 days with 2 hours listening each day. So the time duration is pretty huge. This is followed by around 3 to 5 weeks off, and then another block of 2 to 3, or another 2 to 3 blocks of 2 hours listening each day for 8 to 10 days. And these blocks also have a time off between them, which is a period of 10 to 13 days. So these sessions are 80 minutes a day, and the duration is pretty high for the kids at times. Also, this method does not have enough scientific evidence, which is why it has been criticized by some of the other providers, whether we should use it or not. Therapeutic listening, another very commonly used program. This is a comprehensive, multifaceted therapy program. Now, this particular program does not have one standard progression or length of participation. It is built up by different playlists, which the clinician chooses to, which one to be implemented to the child. It is recommended that, I think somebody is on unmute. Okay, done. Okay, so this particular program is given in 2 listening sessions of 30 minutes each day with a gap of minimum 3 hours. So you're implementing this music 30 minutes in the morning perhaps and 30 minutes in the afternoon or evening, but a minimum gap of 3 hours has to be maintained between the 2 sessions. This music therapy again has to be given with a specially designed headphones, and it cannot be given with the normal over-the-ear headphones. Now, this is one program which does not follow a certain order. So a lot of subjective evaluation, subjective interpretation on the part of the clinician is involved to implement this program. And it does not have a specific formula as to how to implement. This program cannot be mapped in the beginning. So you cannot decide in the beginning that this is what I'm going to implement with my child. Because as it progresses, based on the guidelines and based on the client's response to the music, this program moves further. And here also we have seen the kids who are getting therapeutic listening, a lot of disorganization before the reorganization actually happens. So if we consider all the previous protocols, first thing that we're seeing is that they all use a very specialized kind of headphones through which the program can be implemented. The equipment that they provide is, of course, pretty expensive. So in terms of costing also, the costing increases a lot. Secondly, disorganizations happen. Before we can see the positive changes, we might get to see a lot of dysregulation in the child. which is very troublesome for the parents and the child itself. So, considering those things, safe and sound protocol is one music intervention where we are not finding these kind of problems. So this particular protocol was developed by Dr. Stephen Porges, and it was designed to reduce stress and auditory sensitivity while enhancing social engagement and resilience. So if you see the benefits that are covered by SSP, they're pretty widespread, ranging from your stress reduction to auditory sensitivities to social engagement and resilience. It is not directly working on the sensory system, but since it is shifting the sympathetic to parasympathetic zone, ventral parasympathetic, so it is automatically helping the sensory systems to calm down. It is based on the polyvagal theory that was designed by Dr. Porges, and it opens the door for improved communication and more successful therapy. So this is Porges' view of the autonomic nervous system. In my previous discussion, we have already talked about the autonomic nervous system. Now here he is dividing the parasympathetic into further two parts. Okay, we all know that ANS had two parts, sympathetic and parasympathetic. Here he is further dividing parasympathetic into ventral vagal system and dorsal vagal system. So whenever there is a danger perceived by the body goes into the sympathetic reaction. Okay, the flight or the fright. Now, when there is safety, when the body feels that, yes, this is a safe zone, I'm happy, I'm comfortable here. So the sympathetic system that takes over is the sympathetic ventral vagal system. So this ventral vagal system is what helps us to socialize in a setting and to remain calm in social scenarios. This is where you see that the body or the child is most relaxed. They are making good eye contact. They are reading facial expressions. They are talking. They're vocalizing. They're participating. If there is a situation which is life-threatening, which is perceived as life-threatening or real life-threatening by the brain, then the parasympathetic dorsal vagal system is stimulated, which immobilizes or freezes the body. Okay, so in danger, the body enters into the hyperarousal zone. In safety, it is optimal arousal, and in life threat, it is hypoarousal. So it is not acting at that time. So according to this polyvagal theory, what we just talked, in the middle is the sympathetic system, which gives you the reaction of flight or fight. If the body perceives a safety zone, then it moves to the social engagement, that is ventral vagal. Or if it feels that there is a life-threatening situation, then it moves to the dorsal vagal to the freeze situation, where the body is not reacting. So according to this theory, the ANS is plastic and it learns to stay more activated than necessary. So children, like we talked in the previous presentation, some of the children do not know how to differentiate between the real threat and the perceived threat. So whatever they're perceiving as threat can activate their ANS. This phenomena is called neuroception. So differentiating real and the perceived fear. So the brain is not able to differentiate. If the brain is not able to differentiate, the body will remain in the more tense state or the stressed state all the time. And this leads to chronic defensiveness. Okay, so the child or the person is always in a stressed out zone, on the what we say, it's always on the edge. And this compromises their social engagement, of course, because they're always so stressed, always so freaky, panicky mode. So they cannot engage socially effectively. So what happens in neuroception? Whenever there is a detection of threat, you see these changes. You see the changes in heart rate, sweating, muscle tension, organ slowing, sensory changes, skin tightening, and hair tightening. So we see all these responses happening whenever the body perceives real or perceived fear or danger. Now, the SSP is an evidence-based therapy, and it is said to show, according to the evidence, improvement in these areas: social and emotional difficulties, auditory sensitivities, anxiety and trauma related challenges, inattention and focus, and stressors that impact social engagement. So apart from that, in the clinical practice, like I've been implementing SSP from pretty long now. So seeing the benefits that we are deriving from it is far widespread than what is listed here. We're seeing improvements in the language skills of the children, in their social skills, yes, greatly. Then their cognitive skills, their understanding levels, their expressive language, their non-verbal communication, their understanding of body language is listed in the benefits. So how this particular protocol works. SSP, it involves listening to specially formulated sequence of filtered music. So they have a predefined playlist and they have the modulations already done in their part, and it is provided to us through an app through which we provided to the clients or the children. So they have already given a protocol as to how you have to proceed, and the filtration is done in different sets accordingly. This music is played through headphones and quiet and safe environment. Now, one of the best part, you do not need any special headphones for it. So whatever good quality over the ear headphones you have, you can use it for that. It should just be covering the ear pretty well, so you do not have outer noises coming. We do not need a noise cancellation headphone, but what a good over the ear headphone. So you have to keep the environment quiet and safe. Now, SSP has two things: safe and sound. Sound is given by the music, safety is provided by the caretaker. So, whenever this program is being implemented, the parent or any other supportive grown up who is the caretaker for the child is present during the music protocol. They are present as a safety cue to the child that I am there with you. Because when these physiological changes happen in the body, their system kind of opens up to social interaction. And whatever cues they are perceiving from their social scenarios, from their social environment, they perceive it as true. So if they get a sense of safety, that becomes their they open up more to social engagement, that yes, social interactions are give you a happy feeling and they are nice. It's good to engage in social settings. So during the program, they will of course not be engaging into any verbal communication, but yes, they can do any activity, any creative activity, any fine motor activity, anything that does not involve talking to keep the child engaged if needed. If you don't want to do it, that's also okay. So you can implement this program as per the liking of the child. Just that the child should not be jumping and he should not be eating, because that disturbs the music. So this intervention involves listening to filtered music as we discussed, and it retunes the brain to introduce a sense of safety and ability to socially engage. During the implementation of this program, we also guide the parents that, you know, the home environment plays a huge role, because the sense of safety will come from the home environment. If you have a lot of scolding, shrieking, fights going on in the house, so that is never a comfortable environment. So what kind of social perception can a child have in such an environment? So if you have a calm environment, a cordial relations in the house, then obviously the child also sees that this is how relationships work. So maintaining a cordial setup at that time is very important. And suppose the child does something wrong, so the tackling of the parent has to be very tactful and in a positive manner, so that he understands that if something wrong happens, then also you can communicate. You can always talk. So this allows in this filtration, what we mean by the filtered music is that this music has mainly the frequencies which are ranging in the human voice. So rest of the frequencies are filtered out. So the child starts focusing more on the human voices. Like in our kids, if we see that they're more focused on the background noises and not listening to the human speech. So this program, it tunes them that they have to listen to the human speech better and filter out the background noises. Like when you're talking, when you're listening to me, perhaps you have a fan in the background, or cars running on the road, or some music on the TV or anything like that. But you're able to focus your attention and listen to what I'm trying to tell you. So this is the filtration for the human speech, that you're focusing only on the part that you want to listen to and filtering out all the unwanted background noises. So it provides, uh, it helps the child, like it is for social engagement, not only listening to the human speech, but also emotionally getting attached. Like I said, that it helps in non-verbal interaction. So that gives you that emotional edge over the other programs. So once these interactions improve spontaneously, social behaviors improve, ability to learn improve, and we have seen drastic changes in children. So filtered music, like I told you, that it is keeping the sounds to within the bandwidth of human speech, specifically to soothing frequencies which signal safety and calmness to the processes of neuroception. So the filtration is done in a way that, like to an infant, if the mother coos or says something comfortably or sings a lullaby, the child settles down and the child stops crying. He feels comforted. So the same, because his brain perceives that I am now in a safe zone. This sound that I'm hearing, it calms down the brain, brings him back into the parasympathetic zone from the sympathetic and gives him a sense of safety. So that sense of safety is given both by the sound and the touch of the parent. So safe and sound, both are working there also. In the same way, in this music, it is ranging in the human speech bandwidth, and it signals and it sends the signals to the brain and helps it to differentiate between the real threat and the perceived threat. It also helps the brain to read the body cues for safety. So now when what happens here is that there is auditory stimulation. We'll be going through further slides which will make it clear. So the auditory stimulation, the stapedius muscle is activated, which activates the ventral branch of vagus nerve, regulation of social engagement system of ANS, then which further activates the facial nerve and which helps in better facial expression, better engagement or connection. So if you see here, this stapes muscle, so nearby there is facial nerve and there is auditory nerve and there is a vagal nerve branch going nearby. So when this particular muscle moves, it activates these nerves. So in an ear where the stapedius is not working, it's very thin. If you see the diagram above, let me just annotate it. Okay. If you see here, this is an inactive stapedius. So all the background noises are also coming and this human voice is getting muffled or is getting lost in the background noises. And if you see the perception, so there is hardly any speech received. Whereas when there is an active stapedius, you see the width of this muscle. So it filters out the human speech frequencies and reduces the background disturbance, and you see the perceived response as pretty high. So this particular muscle plays a huge role in activating and filtration of the music, filtration of the speech, human speech. So 1 second, sorry, I think I need to clear it. Okay. So the music trains the auditory pathways by focusing on the frequency envelope of human speech. Children with APD, auditory processing disorders, they have a huge deal of difficulty perceiving the above frequency. So they can listen to loud sounds, they can listen to very small sounds, but they will not be able to listen properly to the human sounds, the human speech. As the child learns to process these speech-related frequencies, they improve functioning of cranial nerves that are important for promoting overall social behavior. That is the facial nerve and the vagus nerve. So these two nerves, when activated and when stimulated, these two are helping the child to pick up the social cues and engage into a better social behavior. So listening is connected with the vagus nerve. There are other methods also of vagal nerve stimulation, but SSP perhaps is one of the easiest ones out of that. And it has pretty good music also, which the children very easily engage into. So as we've already mentioned that it works with a specially filtered music to train the neural network associated with listening to focus on the frequency range of the human voices. So who is eligible for SSP? SSP comes as SSP child and SSP adult, in which they have different playlists, and they have expanded the kind of playlist. Previously, they had only one. Now they have around five. So children above 2 years till 13 years, they are eligible for child SSP, and children above 13 years and adults, they are eligible for adult SSP. How you can administer both in clinic or remotely through home facilitation, online facilitation. So SSP has three pathways. So SSP Connect, SSP Core, and SSP Balance. So Connect is given first, which warms up the nervous system with a gentle and slow introduction and establishes familiarity and a sense of safety. Then comes the main program SSP Core, which is designed to wake up, exercise, and open the nervous system. So this is where we see all the physiological changes mostly happening. Although the changes start with the SSP Connect, but this is the main program where we see the shift in physiological state. And then SSP Balance, it continues to stabilize and maintain a sense of calm and grounding. So it sort of assimilates all the benefits that are achieved from SSP Connect and Core so that they can remain permanently or for a very long time unless they are disturbed by the environmental changes. So it is more like, when you exercise, you warm up the body first and then you do the main workout and then cooling off of the body. So likewise, SSP Connect, SSP Core and Balance work as your workout system. So SSP Connect, it shifts your awareness of physiological states, moves to self-regulation, then co-regulation. So this is how these three three parts of this protocol are working. Okay, before I move on to this, how do we administer it? Now, previously, when SSP started, it was given as a 5-day program for 1 hour each, and it did bring this regulation in children quite often. Just a second. So previously, it was given in that modality. It was a 5-day program. It had only one playlist, and it directly started from SSP Core. 5 day, 1 hour, done, given. And it disorganized the system because the dosage was pretty huge for the children and a sudden shift in physiological state happened, which the body was not able to assimilate. And there was no preparation for the body to, adapt or to imbibe the changes that are going to happen. So after the COVID hit, in the COVID, actually, this remote facilitation actually started. So how the guidelines say is that you can give for 30 minutes per day in the remote facilitation to the client, and it will be administered by the parent or the caregiver. So this 30 minutes duration also, when we started out, now this is just my clinical experience, not given. The guidelines say that you can give it for 30 minutes, but a range of 15 to 20 minutes, maximum 20 minutes is where I'm seeing that there is no dysregulation happening in the kids. And this program, if you give slowly, gives very, very good results. And it ranges like if you start today, SSP Connect, Core and Balance, it takes about 2.5 months to give you and implement the program and brings out beautiful changes. So remotely it is very safe to give, and things to be taken care of, like I said, that the child should not be jumping, munching, or he should not be sleeping at that time. He can be engaged into any activity which does not involve verbal communication. Also, for remote facilitation, the kids who have an history of epilepsy or seizures, so they cannot be the candidates. If they have active seizures history, you cannot give them remote facilitation. If at all, they have to be given, that is in clinic under the supervision of the clinician. So they are not the candidates for the remote facilitation. Plus, for the adult SSP sometimes can trigger strong emotional uh, reactions from the person involved, because it can trigger some of the past memories. Okay. So that is why we suggest that somebody should be around for the safety cue so they can co-regulate that person and calm him down in case that happens. However, it does not happen very frequently. So how is it different from other modes of music intervention? Firstly, like I said, that it equipment wise, if we say that it does not require any special equipment. Secondly, when given in a remote facilitation or when in the clinic also slowly given, it is providing a huge set of benefits, ranging from your auditory sensitivity reduction to your attention and focus, stress reduction, social engagement, social skills enhancement. So this social engagement part is not being tackled by any other music protocol, and which is a huge hurdle our ASD kids are facing. So this program, I think, is the only protocol which is focusing on the social engagement part of children and adults. And there are other protocols which are working on the sensory integration as well, but none of them is working on the social part. So these are very good for this protocol is very good for the emotional and the social benefit of the children. So in conclusion, the SSC exercises the neural pathways associated with regulating behavioral state and social engagement, just like I mentioned. So these two are very key benefits that we are not seeing from any other protocol. Plus, when it is implemented in small doses daily, we are not seeing any sort of dysregulation. Uh, it can happen. It's not that it cannot happen, but the percentage that we're seeing is pretty less. So using the neuroplastic property of the brain, this particular system, this particular protocol is helping children to engage into social interactions and behaviorally regulate themselves. And it has been shown in peer-reviewed research to significantly increase vagal regulation of the heart. Which better controls the state. So it helps maintaining the emotional state of the person, child or the adult. Also, since there is a vagal stimulation, and vagus, as you know, it provides from almost the half of our body. So it has different branches going in different regions. So whichever branch will be triggered, it can benefit. So one of the branches also going in the throat. So for non-verbal kids who have not been able to vocalize, very unlikely, but yes, one or two of them started vocalizing after this. It doesn't happen very frequently. You need that intervention side by side, speech intervention, but it definitely helps. So SSP per se is not the whole therapy in itself, but it is an adjunct which helps the ongoing therapies very well, and which helps the growth of the child behaviorally, socially, sensorially, motorily. Not motor part, I'll say. Motorily, it's not doing much, but sensorily, behaviorally, and socially. So these areas are greatly benefited, the communication part also, if you're implementing this program along with the other therapies. So it is recommended that it should be done in suitable increments of listening for duration which is easily tolerated by the child. So we give it in the duration of 10 to 20 minutes for remote facilitation. For in clinic, we are providing it till 30 minutes. And it is sometimes beneficial to slow down the intervention depending upon how the child is responding. Okay, so it is, you can individualize, you can customize the session duration according to the child, but the playlists are not customized. So they will be given as per the protocol. That is in totality about music intervention and safe and sound protocol.